If you've been drinking tons of water and still feel worse, not better, you're not imagining it. One hidden problem is overhydration, where the balance between water and sodium gets thrown off. Sodium isn't the bad guy people make it out to be. It's a key electrolyte that helps your nerves fire, your muscles contract, and your body hold the right amount of fluid in the right places. When you dilute sodium too much, symptoms can look a lot like dehydration at first. That's why people often drink even more and accidentally spiral. The goal here is simple. Learn the warning signs that your body may be getting too much water relative to salt. Then you can make safer choices, especially during exercise, heat exposure, or water challenge habits. We'll also cover who's at higher risk and when symptoms are urgent. Think of this as a practical checklist you can remember. Moving to slide 2. Let's define what we're talking about. Overhydration is often tied to hyponatremia, meaning low sodium in the blood. It can happen when you drink faster than your kidneys can excrete water, or when you lose sodium in sweat and replace only water. Your kidneys are excellent, but they have limits, especially if you're constantly sipping large volumes. The key idea is dilution. Your total body sodium might not be zero, but the concentration drops because there's too much water in the bloodstream. That shift changes how water moves between your blood and your cells, and cells don't like rapid changes. Brain cells are especially sensitive, which is why neurological symptoms matter so much here. Not every headache is hyponatremia, of course, but if symptoms show up after heavy drinking of plain water, long workouts, endurance events, or extreme hydration goals, it's worth paying attention. Moving to slide 3. One of the earliest clues is that your thirst and your drinking no longer match how you feel. You keep drinking, but your mouth isn't the real issue. You may notice persistent bloating, a sloshy stomach, or nausea after water. That's your gut saying, "I'm full," even if you think you're being healthy. Another early sign is unusually clear, frequent urination, especially if it's constant and urgent. Clear urine can be normal, but if it's paired with fatigue, lightheadedness, or headache, it can be a hint you're overdoing it. Some people also notice swelling in fingers or puffiness around the eyes. That can happen when fluid shifts into tissues. These are not dramatic symptoms, which is why they're easy to ignore, but they're useful because they show up before the more dangerous neurological signs. If your body is pushing back, listen early. Moving to slide 4. Headache is one of the most common low-sodium symptoms people report. The tricky part is it can feel like a dehydration headache, but the pattern can be different. It may come with nausea, brain fog, or a sense that your head feels pressurized. Why would low sodium cause this? When sodium concentration drops, water can move into cells. In the brain, even mild swelling can trigger headache and confusion. You might also feel unusually irritable, spaced out, or unable to focus on simple tasks. If you're in a long workout or a hot environment, this is where many people make the wrong call. They assume the headache means drink more, and they keep going with plain water. A better approach is to pause and assess. Did you already drink a lot? Are you also peeing a lot? Did you sweat heavily without electrolytes? The combination matters more than any single symptom. Moving to slide 5. Low sodium can also show up in your muscles. Sodium helps electrical signals travel, so when levels drop, muscles may cramp, twitch, or feel unusually weak. People often blame cramps only on potassium or magnesium, but sodium is a major player, especially with heavy sweating. You might notice your legs feel heavy, your grip feels weaker, or you fatigue faster than expected. Another clue is that the weakness feels system-wide, not just one muscle group. Some people get muscle spasms or a shaky feeling that makes fine movements harder. Again, this can be confusing because dehydration can also cause cramps. The context is what helps. If you've been drinking a lot of plain water, your urine is clear, and you're still cramping, dilution becomes more plausible. This is also why endurance athletes often use electrolyte drinks or salty foods during long sessions. It's not about hype. It's basic physiology. Moving to slide 6. Your stomach can be a loud messenger for low sodium. Nausea, loss of appetite, and even vomiting can occur as the imbalance worsens. Sometimes people describe it as feeling carsick or queasy for no obvious reason. This matters because it can create a dangerous loop. You feel sick, so you stop eating. Then you take in even less sodium from food. Meanwhile, you may keep drinking water because it feels like the safe thing to do. Another gut-related sign is abdominal cramping or a sense of fullness that shows up quickly. If you're exercising, nausea is often blamed on intensity, heat, or gels. Those can contribute, but don't ignore the hydration pattern. If nausea appears alongside headache, confusion, or swelling, treat it as a bigger warning. Your body is not just asking for fluid. Moving to slide 7. Here's a practical sign you can actually observe: your bathroom pattern. Overhydration often comes with frequent urination, and the urine can be very pale. That alone doesn't diagnose anything, but it's useful context. If you're peeing every 20 to 40 minutes and it's almost clear, your body is trying to dump excess water. But during long events or intense heat, your kidneys may not keep up, especially if stress hormones reduce urine output. So the pattern can shift. Some people drink heavily, then suddenly stop peeing, while symptoms worsen. That combination is more concerning. Another clue is waking up multiple times at night to urinate after pushing fluids late in the day. If your hydration strategy is disrupting sleep, it's probably not optimal. A simple rule is to let thirst and activity guide you, not a rigid hourly target. Moving to slide 8. Let's talk about the red flag symptoms, the ones that suggest the brain is being affected. These include increasing confusion, trouble speaking clearly, severe drowsiness, or acting not like yourself. You might feel unsteady on your feet or have trouble coordinating movements. In more serious cases, people can have seizures or lose consciousness. Those are medical emergencies. The reason is simple. Rapid shifts in sodium can cause brain swelling, and the skull doesn't leave much room for that. It's also why hyponatremia can become dangerous faster than people expect. If severe symptoms happen after heavy water intake, especially combined with prolonged exercise, heat exposure, or vomiting, don't try to sleep it off. Get urgent medical help. And if you're with someone at an endurance event who is confused and keeps insisting they need more water, treat that as a warning, not a plan. Moving to slide 9. Certain situations make overhydration more likely. Endurance exercise is a big one. Marathons, long hikes, long cycling sessions, especially for slower finishers who have more time to drink. Hot environments increase sweat loss, which means you're losing sodium while you replace fluid. Another risk factor is following extreme hydration rules, like forcing a gallon a day regardless of body size and activity. Some people are also at higher risk because of medical conditions that affect fluid balance, like kidney disease, heart failure, or hormone-related issues. And some medications can influence sodium and water handling, including certain diuretics or antidepressants. The key point is not to self-diagnose. It's to recognize when you're in a higher-risk context so you can be more cautious. If you know you sweat salty, white streaks on clothes, stinging eyes, that's another clue that sodium replacement may matter for you. Moving to slide 10. A lot of people ask, how can I tell dehydration from overhydration? You can't always based on one symptom, but you can use a simple decision checklist. Dehydration often comes with thirst, dry mouth, darker urine, and improvement after moderate drinking. Overhydration tends to show up after large volumes of fluid, with bloating, nausea, very pale urine, and headache that doesn't improve. Another differentiator is weight change. In endurance sports, gaining weight during an event can suggest you took in more fluid than you lost. Also, pay attention to salt loss. If you're sweating heavily and only replacing water, that pushes you toward dilution. The safest approach is to avoid extremes on either side. Drink to thirst as a baseline, and during prolonged sweating, consider fluids that include electrolytes or pair water with salty foods. If symptoms are significant, the right move is to stop and reassess. Moving to slide 11. Now let's get practical about prevention, without turning it into a strict formula. First, let thirst be a real signal, not an enemy. Most healthy people don't need to force water constantly. Second, match fluids to the situation. If you're doing light activity, water is usually fine. If you're sweating for more than an hour or you're in heat, electrolytes become more relevant. That can be an electrolyte drink, oral rehydration solution, or simply salty foods alongside water, depending on your needs. Third, avoid chugging large volumes at once. Spreading intake out gives your kidneys time to regulate. Fourth, Don't ignore food. Regular meals provide sodium and other minerals that help maintain balance. Finally, be cautious with social media hydration challenges. Your body size, sweat rate, and environment matter. Hydration is not a competition. It's a moving target that changes day to day. Moving to slide 12. So when should you get checked? If you have persistent symptoms like headache, nausea, confusion, unusual weakness, or swelling after heavy fluid intake, it's reasonable to seek medical evaluation. A simple blood test can measure sodium. This is especially important if you have risk factors like kidney problems, heart conditions, or you take medications that affect fluid balance. Also consider the timeline. Symptoms that worsen quickly over hours, especially with neurological changes, should be treated as urgent. If you're caring for someone else, take confusion seriously, even if they insist they're just tired. And remember, the goal isn't to fear water. Water is essential. The goal is to respect the balance between water and electrolytes. If you've been told to drink more for a specific medical reason, follow that clinician's guidance, because your situation may be different. For everyone else, moderation and context usually win. Moving to slide 13. Let's wrap this up into a simple takeaway you can remember. Overhydration is not about drinking a lot in general. It's about drinking more water than your body can handle, especially without enough sodium to keep the concentration stable. Early signs include bloating, nausea, very frequent clear urination, and headaches that don't improve. As it progresses, you can see cramps, weakness, and brain fog. The red flags are confusion, severe drowsiness, trouble coordinating, seizures, or fainting. Those require urgent medical attention. If you want one practical habit, it's this. Stop treating hydration like a fixed number. Let your thirst, your sweat, and your activity level guide you. And remember that electrolytes matter when sweat is heavy and prolonged. If this was helpful, subscribe for more clear, evidence-based health explanations. And for a quick check-in, comment with A or B. Do you usually drink mostly plain water, or do you regularly include electrolytes? This information is not a substitute for medical advice. Health